I see a patient and their concern is hooded lids, there's a few things that I consider as a surgeon. 1, what is the position of their eyebrow? 2, what is the status of their eyelid skin and or fat beneath? And 3, would they be a candidate for crow's feet Botox? Because a surgical brow lift, a surgical blepharoplasty, and or Botox or Dysport right around here are all considerations to address a hooded eye. Obviously, the patient's age comes into play. The younger you are, the less brow drop you likely have, the less redundant skin you have, and the happier you'll be with a non-surgical intervention that's needed to be repeated every few months. Whereas as we age, the brow starts to descend. The lateral brow tends to descend more than the medial brow. The skin here starts to become lax and sag, and the fat behind the skin starts to bulge forward. And then thinking dynamically, every time we smile, our crow's feet pull our eyebrows down. So let me show you a couple pictures. This is what some people would call a Botox brow lift or a non-surgical brow lift. So here, all I did was inject 15 units of Dysport on each side, so 30 units total in her crow's feet. And you can see that when she smiles or animates, she's no longer able to pull her brows down. And so it gives her a more bright, lifted, open appearance, especially in that upper eyelid space. In contrast to a surgical upper blepharoplasty, on this patient, I removed the excess skin and some of the fat that was pooching forward, especially medially. And you can see that her eyebrows are in the same exact position, but that she's got more tarsal show or more space of the upper eyelid.